So the Master of Science in Adult-Gerontology Primary Care Nurse Practitioner at Daemen College is geared toward nurses who are looking to practice as mid-level practitioners with adults. So a lot of times people ask, well, is it just gerontology? And it is not. What it is the entire adult age spectrum. So if you're interested in working clinically, diagnosing, treating, patients within the adult spectrum, then this program would be for you. When graduating from the program, students will be licensed as adult gerontology primary care nurse practitioners and will be eligible to sit for the certification exam for adult gerontology nurse practitioner. Most students in this program do complete the program part-time, although full-time is an option. When you are doing your clinical sequence, there are 2 clinical courses. In each of those courses, you're doing 250 hours of clinical, and so during those 2 semesters, oftentimes students are taking only that course to make sure that they can accommodate both their classroom, which is 4 hours per week, and their clinical hours, which work out to about 20 to 25 hours per week. Many students are able to work that around their work schedules or to adjust their work schedules during those semesters so that they can make sure that they get those clinical hours completed. One of the advantages of coming to the nurse practitioner program at Daemen is that we're a small program, and so there are a lot of opportunities to work more directly with faculty. Small class size, the ability to meet with faculty outside of the classroom, work with faculty if you need additional help in your coursework. We also work with a very small ratio in the clinical, so that in addition to your preceptor in the clinical area, you would also have a clinical faculty member assigned to you in groups of 1 to 6. And so you would again be meeting in those very small groups, going over your clinical experience, looking at how you can improve upon your clinical skills, and again working to make sure that when you graduate, you are the best nurse practitioner you can be. I think students should choose Daemen's program for the primary care nurse practitioner because we have very solid faculty who all practice clinically themselves, and so they're very current in their clinical skills. We bring in guest speakers so that we can make sure that in all of those clinical areas in terms of the various body systems and the various kinds of diseases that you would be treating, you have the most up-to-date knowledge, and you hear it from people who are out there practicing clinically and are very current in terms of best practice.